The Centers for Medicare and Medicaid Services estimated that 1 in 5 individuals over age 65 would be readmitted after their primary readmission to a cost of $17.5 billion. And what we learned as an organization is that we would be penalized as well if we weren't meeting better standards. So I initially met with the CEO and expressed the business case for why we should have a deeper dive on our transitions of patients from inpatient care to another setting, most typically home. When I met with the stakeholder group in the aggregate, I shared our data as well as the literature. But I think the real story that got their attention was the story of Melvin, and that's the story behind the data.
So Melvin is a typical patient of ours, typically a geriatric patient, usually over the age of 65. These patients are at very high risk for readmission. They have the multiple comorbidities, the long medication list. Typically they're not feeling well, so even if they did understand things, they may not even be physically capable of doing it. So then what ends up coming into the ED, into the emergency room here, and then they end up being readmitted, sometimes multiple times. We looked at multiple different models of transitional care that were out there, and then we were approached by Dr. Amy Kine, who's a researcher over at our VA here in Madison, and she had asked if we'd be interested in adapting the C-TRAC model, the Coordinated Transitions of Care. Our C-TRAC program really involves the nurses driving the program.
My name is Peggy. I'm a nurse here at
They meet the patient in the hospital around the day of admission, introduce the program, talk to them about their 3 red flags that might indicate that the condition's getting worse, and then they set up a time for a phone call within 48 to 72 hours of discharge.
Hi, is Melvin home?
And at that first phone call, which can be a lengthy phone call, they'll review the patient's medication list with them. They'll reinforce the importance of noticing those 3 red flags. The very positive part about this program is that the patient is given the nurse's cell phone number. And the patients love the fact that they can contact the nurse directly. They don't have to go through any receptionist, any office number, and they're going to get an immediate response, immediate answers to their questions, and immediate support for what they need. We looked at the results afterwards. There was a significant decrease in the readmission rate from a 12.3 overall total readmission rate for the institution to 9.2 or thereabouts for our transitional care group. So administration was very pleased with the results. Patients loved the program. And from there we looked at really how can we expand the program beyond the pilot phase.
We've expanded the program to cover some of our surgical patients as well. UW Health now is a 6-hospital system, and we're looking at spreading this across the other hospitals because the success has been very favorable.